Welcome to the Dental Breakdown Show. This show is where we break down issues in the dental marketplace. My name is Christian White, CEO of White & Associates Practice Consulting, Better Business, Better Dentistry. Let's welcome our guest to today's podcast. Welcome, everyone.
Thanks for having us.
Welcome.
Great. Well, I'm expecting a good time today. So, Joe, why don't we start with you and have you tell us a little bit about yourself?
Thanks, Christian. My name's Joe Frickton, and I started Minnesota Transitions with Dr. Dave Lindy. I'm an attorney, and Minnesota Transitions helps with all phases of the practice transition process, from buying, selling, associateships, partnerships, and all the legal issues in between.
Wonderful. Lisa, why don't you go next?
Hi, I'm Lisa Netzer. I'm also an attorney with Minnesota Transitions, and I work with Joe on all those dental transitions and help him with contracts and things like that. I also have an extensive background in employment law and bring that to Minnesota Transitions so I can help dentists with their HR conundrums and help them get back to work.
And they do have conundrums.
Mhm.
Thank you, Lisa. All right, Dr. Frank, you're up.
My name is Frank Milner. Next year, I'll be a dentist for 44 years. I'm an educator as well. I'm also the CEO of Milner Mentoring, which is designed to make you more confident and competent with your clinical dentistry by receiving my personalized mentoring services, which reduces your procedure times and increases your production.
Thanks, Dr. Frank. Appreciate you being here today. All right, Joe, let's get to the meat and potatoes of this thing. You and I both know one of the number one questions on all the dentists' minds is what has the coronavirus done to the value of my practice? Has it reduced it? Maybe it hasn't done anything to it. That's just a number one question on everybody's mind. So why don't you go ahead and start us out with that?
Yeah, thanks, Christian. Yeah, that's a question that I'm getting all the time these days. And the short answer is that not much has changed. When we just kind of backing up, when we value a dental practice, what we're looking at is we kind of look at three aspects of the practice. Number one is we look at the revenue. Number two is that we look at the overhead, the profitability of the practice. And number three is we look at the hard assets, the equipment, supplies, patient records, and then we kind of combine all three to come up with the value. So when someone is going through a transition and they're going to buy a practice, what they're really buying is they're buying an income stream, a revenue stream. And what we've seen across the market for almost all dental practices is that they've all rebounded very well since the shutdown in the spring. And that's been fantastic. We have heard that October, November were a little slow from recall spilling out of the spring, but for the vast majority of dental practices, they have rebounded very nicely, and they're busier as they've ever been. Some practices have kind of slowed down, and we're seeing this second wave of coronavirus cases sometimes impact staffing that can hurt revenue. But for the most part, the revenue has stayed very good. And so as we work through the transitions this fall, that we haven't really seen any major reduction on purchase prices. And I think that's really the right thing. And so, we're going to see combined with that is with the low interest rates that we're seeing right now, the buyers, people looking to purchase a dental practice, are getting a great opportunity and a great deal on the financing side of things. So, and then, one more factor to that is that when a bank is looking at dental practices right now, they're still looking at tax returns for the 2019 tax year. So that is a huge thing, that what the banks are looking for is that the revenues come back relative. They're still looking at 2020 numbers to ensure that there's it's still a viable business, but they're basing their financing decisions on the 2019 tax returns and going back 2018 and 2017, going back 3 years. So right now, nothing is impacted. Now, it's still kind of an open question for 2020, what's going to happen, because as we get into the 2021, get into January, we're going to be start using the 2020 numbers. And we're going to see how banks deal with that. What I'm anticipating is that we are going to do one of two things going forward. One is just to base 2020 on July through the end of the year or June through the end of the year, and just annualize those numbers to make to give us a full year. The other thing potentially is to figure out what dates they were closed, and then annualize, and then just take those months out and then annualize based off the entire year. So it's really important to keep if you don't want to negative impact on your practice, is to keep pushing through the end of the year and keep that production up and keep working on that overhead.
Nice. Joe, let me ask this question. I've seen another trend in the marketplace where all of a sudden, we have all these young dentists who are entering into the market looking to purchase a practice. And you already alluded to the fact that interest rates have dropped, which I think has been allowed a lot more younger dentists to come in and think about buying a practice. Are you seeing that from your end? And you have any comments on that?
Yeah, there are a lot of people. It's kind of gone in waves, I think. Mm-hmm. We had a lot of people looking at dental practices in August and September, and we're anticipating that to, and then things slowed down a little bit as it cooled off, and now things are starting to heat up again. But a lot of people are looking at dental practices, both younger doctors, doctors who are anywhere from 1 year to 5 years out of dental school. And also what I've seen as a big trend is doctors who are 10 to 15 years and kind of mid-career dentists who are buying second locations, third locations, or that they're partnering up with another doctor to kind of expand their, to have multiple locations. And we're seeing a lot of that, and which is great for dentists who are, for a younger doctor who, they might, what's happening with the mid-career doctors is they're giving ownership opportunities to newer doctors if they're worried about taking on a practice by themselves, or if they want to make sure that, they want to have more resources available to them, they can kind of take on a minority share. So we're seeing that kind of across the board, both mid-career and younger doctors.
Interesting, very interesting. All right, that's great information. So I think the other question that I had, Joe, was the whole transition process. How has that been affected by COVID? I mean, you've talked a lot about people are coming out looking to buy dental practices. Younger dentists are coming out looking to buy practices, going through the whole transition process. Is that still kind of status quo now, or has that totally been discombobulated because of COVID?
For the most part, it's status quo. I think that doctors who are buying their first practice are being pretty careful. And we're seeing a lot of some concern about another shutdown, which, I don't think is going to happen. Given the negative impact on just the population from shutting down healthcare for 2 months, and I don't see that happening anytime soon. But I'd say that people are more careful, but they're still going ahead with purchasing dental practices, and it's still very kind of a busy time for practice acquisitions.
I can see you're really busy. I can see there's a little sweat right here rolling down your forehead right here.
Yeah, a lot of what we're seeing is people who are, they've started the transition process like after the reopening, kind of over the summer, and a lot of those transitions are going ahead right now, as well as ones that were delayed during the shutdown, some of those are all ramping up at the same time for the end of the year. So it's very busy. It's a very busy time. And we're seeing that also in the, from the banking standpoint too. A lot of them are underwater with lending. And so it's been really the transitions that have gone the most smooth are the ones that are where the doctors have been proactive about getting financing in place and talking to banks and making sure that the banks have plenty of time to get their work done. And that is one thing that's sometimes caused a delay is the banks not being able to process the loans in time. The banks are still doing a great job, and they're getting they're finishing up all their transactions, but right around the end of the quarter, kind of month end, sometimes we'll see delays on that front.
Joe, can I ask you a question?
Yeah.
Can you make a comment on the two-dimensional practice sales? Number one, people in my generation, are they staying in the profession longer? Are they trying to get out? And number two, are the younger dentists, are they looking in the rural communities for a better purchase price, or they want to stay in the cities?
Well, from the people towards the end of their career, I think that we saw a number of doctors who wanted to stick around, and then the COVID shutdown in the spring was kind of the catalyst to kind of move that process forward. And so we saw kind of a wave of doctors who wanted to retire in the springtime, and now we're seeing that. And now we're kind of seeing that again in the fall, that a number of doctors are looking to either sell their practice and continue to work potentially, or just kind of hanging things up and not wanting to deal with all the extra PPE that they have to wear, and the regulations and the staffing, which we're going to be talking about. Which is just a huge problem right now, trying to find good staff. And so that's just caused a lot of headaches. I think that some doctors are not, they don't want to deal with. And there's opportunities for a doctor who's looking to retire. If they're not ready to be done practicing dentistry, there are opportunities. I mentioned those mid-career doctors who are buying additional locations. What we're seeing is that they will potentially buy a practice and then keep on the selling doctor as an associate for a period of time. And that allows kind of the best of both worlds, where a doctor who is a senior doctor who doesn't want to deal with ownership anymore can sell their practice, not worry about the administration as much anymore, and the risk of a shutdown, and kind of lock in that transition, but as well stay on as an associate and keep practicing dentistry, which is kind of a great opportunity. On the younger side, they definitely have, they can take advantage of it too. And as far as going rural, one of the things that we found that's very interesting is that we're seeing a number of doctors come from out of state, from the West Coast and from the Arizona in particular, and want to move to rural Minnesota because they have student loans that they need to pay off, and they're looking for that reasonable purchase price and highly profitable practice. So they will move wherever it is to pay off those loans and to find kind of a more relaxed lifestyle. So definitely people are looking for, and that's what I tell, all dental students and anyone who listens, is that if you can go at least an hour outside of the metro area, the lack of competition and the demand for services makes these practices just hugely profitable, and just they can choose how they practice. They want to be very busy, work 5 days a week, or slow down. I mean, when a practice is that profitable, they get to pick their lifestyle, be as busy or as slow as they want, which is very nice. And you don't see that in the cities. I mean, there's very profitable and successful practices in the cities, don't get me wrong, But it is more of there's more competition for patients, and so it makes those rural practices very desirable.
Amen, Joe.
Yeah.
I was gonna ask, you just kind of answered my question. I was gonna ask, are you seeing more people move out to the rural areas? Because, with our business, we are, when you're in the cities and you're writing off 25 to 35%, 30% just right off the top, and you can go out an hour, maybe an hour and a half outside the cities, and what you're writing off goes down drastically. I mean, it just kind of makes sense.
Well, and people are still living in the suburbs or around the metro area, and then just commuting 20 to 30 minutes out from the cities in a more rural area. That's still happening. And then someone gets the best of both worlds. They get a very highly profitable practice, but at the same time being living in an area that they want to live in.
The Dental Breakdown Show, sponsored by White & Associates Practice Consulting, Better Business, Better Dentistry. They are a practice management consulting firm for dentists and other healthcare-related businesses. Their sole purpose is to implement proven strategies through online and in-practice visits and result in the personal and professional success of the dentist and his or her team.
Lisa, let's jump over to you. We're going to switch topics entirely, and we're going to start talking about the staff. And this is where things get very exciting.
They do.
And the excitement, and that is no joke, because the excitement is going on right now. And nobody knows that better than you. Yeah. So I guess my first question for you is, I'm a dentist. What happens when a staff member or staff members ends up getting COVID? What happens? What should I do? Let's chat about that.
So that is the number one question I'm getting from dentists directly right now is, oh my gosh, one of my staff members tested positive for COVID. Now what? And the now what really tends to focus on whether they need to pay that staff member while they're out sick or they don't. And I just want to make clear, because there's a lot of misinformation about the Federal Emergency Sick Leave Act, that most dentists are exempt from that act. And there is no requirement from that law that you pay sick leave. Now, that doesn't mean that you can just say, I don't have to. You actually have to take a couple of steps. So if you have an employee who's homesick and they say, I'm sick, I want to get paid sick leave, they have a right to do that. They have a right to ask, because the law applies to every American. But just like how FMLA and certain ADA provisions do not apply to dentists, what you need to do is document your response. That's what's important about this exception. It's not automatic. So the exception level is, if you're under 50 employees, you can be exempt. And I actually want to talk about the opposite of that, which is if you decide you want to take part in that sick leave act, which you can, but most dentists don't want to. They don't have the funds or the liquidity to pay a lot of sick leave out to people. So if you have an employee who's out, the number one thing you have to do is just document some really simple facts. Those simple facts are that you have, number one, less than 50 employees. Most dentist offices have between 10 and 15 employees. Just document how many you have. And then you document why the person asked for sick leave. Did they need it because of school closure? Did they need it because their childcare is not available? Are they COVID positive? Are they caring for someone who's COVID positive? So you write down that too. And then the third thing you have to write down is that an authorized officer, in most cases the owner, said that they fall into one of the three reasons for an exception. The three reasons you can have for being exempt is, number one, I can't make my budget if I'm paying out sick leave. Number two, the giving this person paid leave risks my ability to carry my business into the future. So your ability to be an ongoing business, if it's just going to knock you down, that's a great reason to not be granting sick leave. And the last one is, I don't have anyone who can replace this individual. For a lot of people, especially in outstate Minnesota, there aren't hygienists floating around everywhere. There aren't dental assistants floating around. So this particular skill set is really important, so I can't grant them leave. And you document one of those three reasons or all of them, whatever applies, you put it on a piece of paper and you close the file. There is talk of the U.S. Department of Labor and the Minnesota state agencies that could look into these requests if they find out about them later. You just need the paper trail from when the person asked for leave. I'd also recommend, besides thinking about this, you think about your employee handbook. Does your employee handbook grant sick leave, paid sick leave, or anything like that? And keep in mind too, OSHA applies to the situation. So if you have people who are sick, you are supposed to report to OSHA that someone was sick, even if you don't think they got it in your office. That's not the question. The question is whether a disease occurred in your office, and you are documenting that. In fact, there's some talk out there about OSHA being more efficient than some of the other tracing going on out there in Minnesota right now, but it's important. It's important to make sure you do that. Now, the twist of that question is, what if you want to be able to pay your employees? What if you're in a really competitive market and you want to stand out as a great employer who really takes care of their employees? Well, if you do pay out sick leave to someone who's COVID positive, you get a tax credit for the sick leave you pay out. And that is under the Emergency Sick Leave Act. And so your accountant can help you figure out what that looks like, but there is tax incentives to do so. So if you can float it, if you can make it work and you can do it for your employees, you might want to consider it. But again, a whole nother set of considerations that you might want to think about for that. But there are some places who either are above that 50 employee mark that we've worked with, who are getting that tax exempt or that tax credit and documenting things so that they can claim the tax credit in next year's taxes.
So do you see a lot of employers doing that? Are they saying, I want, and just because, especially here in the Twin Cities, Joe alluded to how competitive the Twin Cities marketplace is, and I think we would all agree with that. Do you see dentists doing that, where they're willing to pay the sick leave for, their staff members who get COVID and who are out for 2 weeks?
So what I see is if they have a pretty substantial practice and they have an established employee handbook that gives people a right to sick leave, there is some talk about granting sick leave because they would get it anyway under the handbook. And this way they get a tax credit for giving them the sick leave. So there's that. For further out practices, I'm not seeing that as much. Most people just want to know, do I have to pay? And the answer is you don't have to. So that's about as far as the analysis goes for some dentists. And the truth is, some small offices, they can't afford it. I mean, that's just the bottom line.
So if I'm a dentist and I have a staff member who, is sick, what's maybe walk me through the protocol. Do I have to tell all the staff? Do I then make sure they go get a test? Do we then, the next day we all go get tested? And then how does that work?
So that's the question that gets into the whole quarantine question. And that's a huge issue for dental offices.
Right.
Because if you had a staff member who was in and then maybe they were exposed to something that was a little bit risky 10 days ago and they've been coming into work and everyone's been around them, how much exposure have people had? And, that's a really good question. The first thing I want to tell you is that if you have staff members who are out because they were exposed to someone, either in the community or in your office, and they're staying home to quarantine because they're waiting for test results, you don't have to pay them for that. Because you can even order them to return if you think it's kind of someone's dad was over for a couple minutes and maybe there was some exposure time for if it sounds pretty fishy, you can order people to return. And that's because the laws that were passed in the spring recognize that medical providers might not get the same amount of time off to self-quarantine as others. And dentists, hygienists, and dental assistants are clearly medical providers under the statute. So they don't have to be gone for the 14 days if they have been exposed. However, dentistry is about trust and about your patients trusting you. So if you've got a hygienist who thinks she should really be home and not in someone's mouth, that might come across. And in small towns, people talk. People know who they saw at a bar where maybe there was an exposure or a spreader event, and they know what's going on. So I also think you want to be careful about what kind of trust you want to engender with your staff and with your patients. But what's the right answer? Well, number one, people came up with a preparedness plan back in March. Check that out. Did you think about this then? Some of the science has changed. You need to update that plan. Make a plan now, because that's the number one thing I see from dentists is they finally get that positive COVID case and they haven't thought about what they're going to do. So if you have a plan, it's less panicky to say, well, this is what we want to do. This is how I ideally carry it out, and you have a plan in place. That's really important. What I would encourage people to consider is whether one negative test is enough, because if someone is exposed to a person who is COVID positive, they might not show up as positive for 2, 3, 4, 5, 10 days. It can take that long for the virus to show up. In fact, some college campuses are getting kids on that 14th day. They've been quarantined for 14 days, and on 14th day, they've turned positive. They're a great little test subject area for people because they're quarantined and they're locked down. So people are finding out that even on that 14th day, you can test positive. I'm not trying to say that's what you want to do for a dental office. You don't want your staff gone for 14 days, but maybe 2 negative tests. Do you want to think about that? Or do you want to think about it in context of your whole community and what people are watching and what people know? That's another thing to keep in mind. So make your quarantine plan now. Have some ideas about it. Talk to your team about it. Tell them what your plan is. Listen to them. Listen to what they have to say about it. And get ready, because this question shows up in my mailbox way too often, that someone tested positive and now what? Think about it, because it's really important to plan for these major events and how you're going to handle it.
Well said. And I brought that up because I had a client yesterday that called me up that had a staff member who went in and got tested and texted her yesterday and said, well, I'm positive. And, and she said, oh, crap, that wasn't the word that she used.
Yeah.
Excuse my sigh. But it's now, but I think that now what?
Mm-hmm.
So if I have someone in my office who tests positive, but I still have the rest of my team who's not, who, seems to be healthy, now what?
Mm-hmm. Yep.
What do we do now?
Exactly. I think that the question really is, who is that person? What kind of patient numbers do they have? Could you handle those patients by assigning them to other people or not? If that doesn't work, what are you going to do? I would say you probably need to make a plan, assuming someone on your staff is going to test positive in the next month. That's the kind of numbers we're seeing, and that's, if you have that plan and you never have to use it, great. If you have that plan and you have to use it 3 months from now, that's fine too. Science keeps moving, so I encourage people to, if you had a plan back in March for how you're going to handle it, look at it again. Look at the testing capabilities in your area. Minnesota has free testing all over the state now. It really shouldn't be a big deal to go out and get tested. And your other staff members hopefully can do that, especially now with saliva testing. It's not so invasive as that darn nasal swab test.
Very true. Now, Joe, let me come back over to you for a second. Now, legally, is there, a concern for dentists if a staff member is sick and they don't do it, they don't tell the rest of the staff about it, or, if a patient then gets it from someone in the office and, the office maybe didn't do what we're supposed to do? I'm just kind of throwing that out there as just a conversation piece.
Yeah, well, that Lisa probably can answer that question better than me.
Oh, okay.
But it probably, it's definitely a, there's an OSHA aspect to it that needs to be considered, and making sure that they're complying with their, OSHA handbook. And, from a transition standpoint, you don't want to be that practice that shows up in the news as the practice that is transmitting where you got COVID from going into an office. I've not heard of any to date of any patients who have received COVID from going to a dental office, and you don't want to be that first one.
Okay, I just thought I'd ask. That's
always Lisa, what do you think?
Yeah, go ahead, Lisa.
So the question about getting it, there's a reason why Minnesota Board of Dentistry has that release form that every one of your patients should be signing that says, I understand I'm at higher risk of getting COVID-19 because I'm coming to a dental office. And everyone should be signing that when they walk in the door. So there is that, but there are also OSHA regulations that say, hey, if you didn't take what is advisable right now from the board and the CDC and the Minnesota Board of Dentistry to keep people safe and keep your staff safe, you could face liability from that. And we do what I would say more realistic situation is someone on your staff quits because they don't feel safe, and then they make an unemployment claim because you forced them out. I've seen a couple of cases like that. It is an issue out there, and so that there are protections for workers under OSHA. So follow the rules, keep up to date on the science, do what you need to do to keep your staff safe. They're your best investment.
The Dental Breakdown Show, sponsored by White & Associates Practice Consulting, Better Business, Better Dentistry. They are a practice management consulting firm for dentists and other healthcare-related businesses. Their sole purpose is to implement proven strategies through online and in-practice visits and result in the personal and professional success of the dentist and his or her team.
The next piece, I'm going to jump in here real quick and talk about some trends that are going on with the practice management piece. And the first trend that I'm going to talk about, I call the big squeeze. And it's actually been going on for a while. It's just COVID has really heightened what's going on. Most dentists who are out there have had a past of when staff want a raise, they've just been given a raise every year just because they've been there one more year. And the dentists love doing that because there's no problems with the staff, there's no arguing, and they can go back to op number 2 and do dentistry and not have a confrontation, which we do not want to have. And so all of a sudden now, here we come to COVID starts in April, and here we are sitting here in November. And because of most dentists who have seasoned staff, because of how they have handled the staff in terms of raises, all of a sudden the overhead for most dental practices now, is between 75 and I'm seeing in 80% for a lot of them. Joe, we could probably have a little bit of a conversation about that, but it's exceptionally high. I mean, 60% used to be the norm. Well, not anymore. So all of a sudden, we have the virus come in, our production in the office has gone down, the office was shut down for a month, things are kind of coming back, which is great. And then all of a sudden the staff come and they knock on the dentist's door and they're like, gosh, I'd really like to have a raise, please. Because if you don't, I'm going to go down the street into XYZ Dental and get $1.50 an hour more. So the dentist gives it to them, and we have a problem with the overhead going up. That's on one side. So we have staff, we have a marketplace that is extremely tight in terms of employment. Both Lisa and Joe, you alluded to that. The staff, trying to find really good staff right now is very difficult. So there's a huge emphasis on keeping the staff you currently have, and for some very good reasons. Dr. Frank, if your dental assistant decided to leave to go down the street for $2 an hour more, that would probably be a big blow for you. Just because,
that would be the end of me.
Yes, that would be really tough. So that's happening to the private dentist on one side. And the other side, we have the insurance companies. And the insurance companies right now are doing everything they can possibly do to delay payment on claims to the dental practices. I'm seeing that across the board right now, and they're using the coronavirus as an excuse to delay payment. They're exceptionally slow. I've got dentists who haven't received 85% of their money from the month of October, and here we are sitting here in the middle of November. So it puts a real strain on them. So that's just, that's why I call it the big squeeze, because, the dentists are being squeezed from the left and from the right now. And it's a really tough situation that they're in at the moment. The other thing that's going on, and this is a little bit newer, but I call it demonstration marketing. And since we've had the COVID virus hit, patients are fearful. As all of us, do we go to a dental practice? Am I going to be safe? Am I going to get it? Am I going to come out okay? Can I go to Target and shop for groceries? I mean, that's I get that a lot too. Am I going to be okay? But going to a dental practice, ooh, that's scary. So one of the things that I have suggested to most of our clients and to most dentists is you need to show the patients what it's like to come to your office and how safe it is. What are you doing to keep the patient safe? How are you doing it? What is the staff doing? And you need to demonstrate to them what you're actually doing when they arrive. It's not just what you're doing, but how you're doing it. And a lot of the practices, I've had them do record a video. We're not looking to get a Grammy, or excuse me, we're not looking to get an award for best recording. But what you do need to do is have someone on your staff walk through your office as a patient and just show what it is that you're doing. It doesn't have to be professional grade. Frank, you can make a comment on this. I know you've kind of done some of this in your practice. But it's helped out tremendously for patients to see that when I walk in, okay, the reception room is not full of people. There's lots of space. They take me back. The person taking me back has gloves and a mask on. The doctor has, 3 layers of PPE on. The hygienist has at least 2. And this is what we're doing. This is what we're doing, to make sure that I'm safe. I'm having less and less contact with people in the office. I can come in, I can get out, and I can do that in a reasonable amount of time and be safe. So that's something I'm really suggesting all practices do that. It's just
Christian,
yes.
Can I make a comment?
Yeah, please go ahead, Dr. Frank.
We did our first series of webinars on the COVID, and you're coming out of the COVID part 1. This is part 2. I can tell you most assuredly that when prospective new patients are checking out your office, they may say, are you in my network? I'm close, etc. But they go to the website to make sure the reviews on health are very good. And the practice, my practice, is we're getting so many new patients based on the reviews. And it's not the convenience of hours, extended hours, working on Saturdays, Sundays. They're looking for, can you keep me healthy? And what are other people saying? It's very powerful. I've never seen anything like it.
It's very powerful. A lot of the offices that I have seen that have handled this really well, that, kind of like with Lisa, when the offices that had a plan ahead of time, Lisa, and are adjusting that plan as we're kind of moving into part 2 of COVID. They've also done it with their marketing, and they've taken a series of videos and just posted it on Facebook, on their Facebook page. They've got it embedded in their website. So, and they're letting patients know that it's there so they can go look at it. That has had an unbelievable, tremendous effect on the amount of confidence patients have in going to those offices. Their schedules are, really full. That has really helped them rebound. That to quote Joe with what he's saying, that's been a really good way to get patients back in the office, to show them how safe it really is to be in our office. I can't suggest that enough to all of our clients, but to all dentists. Excuse me. Go ahead and do that. That's a really big deal. All right, now what I'd like to do is turn it over to Dr. Frank. Okay, Dr. Frank, why don't you go ahead and start talking about the clinical piece of dentistry and kind of how that's been affected by the COVID virus.
Okay, well, thank you for the invitation to be here once again. I share my knowledge to anybody who will listen at this stage of my career. And I've never seen so much change in a short period of time. And for a baby boomer going through a series of changes, this is the one that I think impacts me the most, because it's about my health. It's about the staff's health. It's about the patient's health. Back in time, it was about technology. It was about dentistry, improving dentistry with products and techniques. This is about health now. This is a serious matter. And when we went over the waterfalls in the COVID with the dental manufacturers and the patients and the staff, when we came back, we were really sensitized. Can I touch a doorknob? We were really acutely aware of everything that's going on. Now we're getting a little bit more normalized with the COVID protocols, CDC, PPE, and the thing that I can tell you on the next slide, Christian, is it's changed so fast. Patients come around the first time out of COVID and they're looking at everything. They got their masks on. It's very rigid, as it should be, but now they're getting comfortable going to the dentist because they trusted we're taking care of their health. Now, I'm a trend spotter, just like Joe, Lisa, just like you. I put my ear to the ground and I can get the vibe of what's going on. And the new normal now is once they've come to your office, now it's going to be health-centered guided dentistry. Before it was emergency dentistry, just I have a broken tooth, doc. I waited until you opened up and I was scared of coming in, and finally I'm here. Now I feel a little bit more comfortable. The patients are going to look for some very, very definite things. They're going to look for people who can keep you healthy. And they're going to talk to their neighbors, their friends. They're going to put social media content about your practice. They're looking for a practice that has constant growth with health. How do you keep me healthy? What caused my disease? They're looking for practices that are lifelong learners, and they're looking at from the doctor and they're looking at from the staff. They can see who's been mentored, which feeds back into what I do. And they're looking for a healthy practice because they're going to talk to the staff when the doc's not in the room about what the PPE is, what's it like working here? Do you really feel comfortable here? Or am I healthy here? And they want to know what a healthy system is. Now, the big transition now is that dentistry is part of healthcare. We're not just dentists, we're part of healthcare. We're really preoccupied with the oral environment, but the oral environment is connected to the systemic health of the patient, the heart, everything, the bacteria, the stomach, the digesting. Do they have enough teeth? Can you keep the teeth in the mouth? Are you losing teeth because of poor dentistry and now you're in implants? And then it becomes a financial question, because if you can demonstrate to keep people healthy, and part 2 will be about how long do we live and how does that affect my treatment planning? But the patients want us to be facilitators of healthcare and not just the dentist. And that takes a lot of improvement of education and knowledge, which in my view, you need some mentoring to show you that. Can you look at the next slide? So in a schematic of talking points, we're really about, in the next part, we're going to go about predictable dentistry, what that is. It's guided. We're talking about building relationships with our staff to empower the staff so they know about healthcare, they know about healthcare risks, they know about dental risks. Then you can talk about dentistry, but you have to build relationships. And as Lisa said, the most important thing is trust. Trust that you can keep your patients healthy. And also, an important factor is, from the patient standpoint, is the experience with the dentist. What did that mean? Are you focused only on the subjective part of dentistry, which are, oh, you have a cavity, you need a crown, you need a procedure? They really want to know, what does this mean to my overall health? How can I preserve my health? To give them peace of mind so they can get into a position and make comfortable decisions financially, as well as the dental work. It could be how much insurance pays, all that. This is kind of long-winded, but the objective part is called the condition. The findings from the dentist is, yes, you have a disease-related issue, but this is how it impacts your health. And this is how it'll impact your health for the rest of your life. The subjective part is the factoids, is the problem. Oh, I see you have a broken tooth. That's subjective. Oh, I see you have a toothache and or swelling. That is subjective. But the objective part is, how do we manage this to keep you healthy? Now, with your guidance too, Kristen, you really want to link the two of them together, and that becomes the solution to keep you healthy. Before we can fix the problem, we have to know what caused the problem, and that's called risk assessment. When I do this in the practice, patients really take notice because they've never had this conversation before with previous dentists. As good as they are, they don't put the tools down and have a conversation to build a relationship. Then the patients can price test what you're linking the subjective to the objective is. Really, the bottom line, Christian, is it's not what you know about dentistry, it's what you know about your patients to get into a position so they can price test you and they get a good feeling of trust and confidence. This is what I think the next step in dentistry is. It's about healthcare, because we are part of healthcare. What does this mean for the long term? We're going to address this in the second part of the webinar. Do you know, and does your staff know what health is? Not just the mouth, what health is to the heart, the brain, sleep apnea, occlusion. How can you maintain these teeth to keep them healthy up to their 85th birthday? You see, if you go to your doc and says, take a pill because you have high cholesterol, do you really know what cardiovascular disease means? If you have hypertension, high blood pressure, will they just give you a pill to prevent a stroke? Do you know what a stroke is? Do you really want to avoid one of those? Well, it's all about healthcare. We happen to be part of healthcare, only in the oral environment, but it relates to other parts of healthcare. So that's what I think the next part will be, is not only can you trust this office to keep you healthy by demonstrating you have the PPE, did you adhere to the ADA and CDC guidelines, or did you go above it? Our office went above it. It's on the website. It demonstrates the confidence that the staff has in your office to protect you, the dentist staff, but mainly them, Christian. I know this is the next leg up post-COVID.
Frank, I think you made a lot of really great points. I think that, in the COVID era, I'm going to talk a little bit about this in the next segment, so I'm jumping ahead a little bit, but I think in most dental practices, you have to think of, dentistry is a solution business. There's a problem, here's a solution. And when nobody does the solution, no one can understand why the patient doesn't move ahead with it. And you hit it right on the head. It's somewhere, there has to be a feeling in there, and it can't just be about the filling. And I think you would agree with me on that.
I would, and I would also engage Lisa and Joe when you are dealing with your clients, Joe and Lisa and Christian, are you a dentist or are you part of healthcare? And I think it would speak volumes for both of you to mention this, because if you're selling a dental practice, I think you're only part there, and I think you're part of healthcare. And what people are really looking for is people that know how to manage their health to improve their overall health care. You just happen to be a component of healthcare. And I would take advantage of that, Joe and Lisa, to make sure they understand that, and or get them mentored up to improve the value of their practice, because you're going to get better social media contents. Wouldn't you think so, Christian?
Yes, I would agree with that.
Well, and kind of following up on that is that if you have a healthy business, then the stress of running the business kind of falls away, and you can focus on the health side of healthcare and the patient's health. And so you don't have the extra stressor of managing the business.
And I think it goes back to the employees too. When the employees feel that they're able to provide really good care to patients, and their doctor supports them doing that, and they don't get yelled at about their production numbers because they spent an extra 5 minutes talking with someone about their type 2 diabetes and how that's affecting their gum health, Yeah, those are important connections, and it's important to realize that the whole staff needs to be making those, not just the dentist.
Lisa, in a dental practice, you hit it right on the head. Staff members will sometimes get chewed out because they spend an extra 2 minutes with a patient because the patient had a question, and because the 2 minutes was spent, the patient went up to the front desk and scheduled. And the dentist or the office manager doesn't always see that piece of it, and that's a really important piece to know that. I mean, in a dental practice, if you want to kill a hygienist's confidence or an assistant's confidence faster than anything, is chew them out in front of a patient. Or if a patient, if the hygienist or assistant has had a discussion with the patient about something that's going on in their mouth, and they point it out to the dentist, and then the dentist does nothing. That's another huge confidence killer, which affects everything that we're talking about and gets right back to what you're talking about, this idea of health, Frank.
Well, for instance, how long would it take a hygienist, assistant, or a dentist to put a piece of litmus paper in the patient's mouth to check the pH of the resting saliva to see if they're acidic? Do they buffer? Because if they're acidic saliva, that's part of the digestive system, and that's also a risk factor in healthcare because they're in an ecosystem that's going to demineralize tooth structure, which leads to bigger health problems, loss of teeth and digestion and everything else. So it's so easy. It's just there. All we have to do is talk about it and give the staff a chance to learn about it and share their knowledge with the patients.
All right. Thank you, Frank. This was a great discussion. Thank you very much, everyone. Joe, Lisa, Dr. Frank, thank you so much for being on the Dental Breakdown podcast today. I think the information that we just shared is going to make a huge impact, not only on our listeners, but also on the private dentist who's out there right now in the marketplace trying to make a go of it. So thank you very much for being here today. To all of our listeners, if there was a topic that struck your fancy, if you want more information, please go to whitedentalconsulting.com/breakdown.
Thank you for listening today. I'm Christian White, the CEO of White & Associates Practice Consulting, Better Business, Better Dentistry. If you would like more information on today's topic, you can contact us at whitedentalconsulting.com/breakdown. Keep those teeth white and see you next time on the Dental Breakdown Show.